Hello friends, I am Dr. Kavita Srivastava, Professor in Pediatrics and Pediatric Neurologist at Bharati Medical College. Today we will be talking about the first aid which knowledge is required for the general public to manage a person with seizures. So there are two components of the first aid for seizures. First is the recovery position and second is the emergency medications if you have them with you. In case you don't have the emergency medication, then even giving the recovery position is sufficient because most of the seizures will stop in 1 to 2 minutes. So now we will talk about the recovery position. So suppose this person is having a seizure or this child is having a seizure. So mostly you will see that there is a lot of froth coming from the mouth. The child's hands are completely tight. They may be shaking violently like this. The head may be shaking violently like this. So what are we supposed to do as a bystander? So first thing is do not panic. Okay, note the time when this, because this information will be required later. So note the time, okay, and see that the patient is not in the middle of the road, okay, not wearing very tight clothing. You can maybe just loosen the clothes, okay, so that the child is not constricted, not wearing a very tight clothing. And then comes the role of the recovery position. So you can see this froth coming out of the mouth, right? It is going to go into the lungs and cause choking, and that can kill the patient, not the seizure itself, because seizures will probably stop in 1 to 2 minutes by itself. So the first thing you need to do is do the recovery position. So for that, what you need to do is you can just take the child en masse, because it's very difficult to turn a patient when he's convulsing, when he's so tight. But try your best to en masse. You may have to turn the patient like this, okay, and so that this helps you to decrease the level of the head from the rest of the body, and all this froth which is coming out will just drain onto the ground and not go into the chest of the patient. The second thing, this seizure will probably just stop in 1 to 2 minutes. Once the patient stops seizing, then you can maybe just observe him in this recovery position only for 1 to 2 minutes till the patient becomes completely conscious. Once he is fully conscious, maybe ask him how is he feeling, give him water if he is fully conscious and wanting to drink water, be with him till he is fully conscious and able to walk and talk freely. So that is about the recovery position. Sometimes if the seizure is not stopping within 1 to 2 minutes and it is continuously going on, and this head is banging onto the floor, or some body part is getting again and again irritated by some hard surface, so you can take some soft cloth, like this cloth can be just slid behind the neck of the patient or the head of the patient, so that it prevents the further injuries because of this violent movements. Similarly, if you find that something is obstructing the mouth, do not put your finger directly, try to open the clenched teeth. Okay, maybe you can just put a handkerchief on your finger and just try to gently remove something which is just coming out onto the mouth. Do not try to forcibly open the mouth or force open the teeth. You will just break their teeth and cause more tongue injuries. So this seizure will automatically stop in 1 to 2 minutes. In case it is not stopping and your doctor has advised you to use certain of these emergency medications to be kept with you at all the times or at home, then these can be used. And the dose will depend on the weight of the child, weight of the person, and these have to be used as guided because there are different strengths of this medication available. So mostly you should first check whether it is patent. So you can maybe just blow it once in the air. You can see that it is patent, and then insert the nozzle into the nose like this or into the mouth like this, okay, and then give the required amount of doses by pressing it down. So for a 10 kg child, usually it will be 2+2, but depends on the strength of the medication which is given. So that has to be confirmed always with your doctor and not be used by your own. This medication is a kind of anesthetic medication, the same medication which is used by the doctors as an injection to stop the seizure. So after giving this also, the child needs to be in the recovery position because this will cause either heart or breathing related irregularities. The respiration may become slow, the heart sounds may become little feeble, the pulse may become slow. So you still have to observe and of course call for help till then and Again, observe the patient till the child becomes normal or is taken over to a hospital in an ambulance. By the time the help may arrive. So by the time you give the spray, you should also call some passerby or ask somebody to call the hospital or the nearby ambulance and prepare the child to be taken to the nearby hospital. If you have a pulse oximeter at home, if you have given the spray, then also monitor the oxygen saturation by putting the pulse ox on the finger. Nowadays everybody is aware because of the COVID pandemic how to do that, and keep checking the saturations till you reach the hospital. So if the child's breathing and cardiac system is affected, then the doctors will give the necessary management at the hospital. So when you give the spray, when you give this medication, beware that this may give rise to complications. So always use it with the preparation to go to a nearby hospital. So previously there were lots of myths that you give a very bad smelling shoe or give an onion or put something in the hand like a key or some iron object which will stop the seizure. So they usually work because it's anyways going to stop. But do not waste your precious time in all that. Okay, the seizures happen because of excessive abnormal electrical discharges in the brain, and the remaining brain tries to overpower them, and that's why most of the seizures will last for 1 to 2 minutes. So do not waste your time in doing all such things, but please give the recovery position, and if you have the medication, then use it. Thank you very much.